Hi, my name is Sheridan Gaxiola. For my UDL instructional plan, I observed some people doing ABA therapy in the clinic that I work at. We were observing a boy, R, who has autism. He's 4 years old and he's in preschool and he receives speech therapy and uh, he has done occupational therapy as well in the past, but mainly ABA is what we focus on. Um, he is very good at communicating, but just has trouble with certain labels and making decisions. And so the lesson that I observed was of him making or labeling people and verbs in 2D pictures. So the goal is him having a correct label of the verb or person without prompting. And so it's just him and the teacher sitting at a table. The therapist has a stack of cards, two stacks. So one is a stack of verbs, and then the other is a stack of people. And they're both just line drawings of people, so they're black and white. Um, and he is really good at working because he's a people pleaser. So if you want him to do something, he's usually pretty happy to do it for you. So that makes it really nice to work with him, but he does have a bit of a attending struggles. I mean, he's a 4 year old, so that's pretty common. And he's very advanced with most of our cognitive programs. So he masters a lot of his programs very quickly, but he doesn't retain them very well. So when it comes to generalizing or maintaining those skills, he's usually um, a little bit behind when it comes to the labeling. So that's why I chose this uh, lesson in particular, because it is something that you have to do correctly for the first time or it won't maintain. So let's see. And he's not very interested in labeling pictures. If it was more of like a video or if it was a real life 3D object, he'd be more excited. Um, but he's just not super interested in the verbs or the people that we're doing. So what we do to make it more motivating for him is using reinforcers like sand. That's his favorite. iPad time if it's necessary. Tickling, throwing them up in the air, playing tag, all of that kind of stuff. And he also uses a token board. So he has 10 tokens on his token board, and so once he gets all 10 of his tokens, he's able to get his reinforcer. And a lot of the times what we'll do with him if he's struggling is we'll give him a token per or a dinosaur per token on the token board, because he really likes to use the dinosaurs with the sand. Um, and then that can kind of motivate him to keep going until he can actually get his full reinforcer with all 10 tokens. So the therapist holds up a card and says, "Who is this?" or "What is this person doing?" R should then respond with the person's title. So mechanic, a woman, there's like a clown card, there's a teacher, farmer, all that kind of stuff. And if he gets it right, he gets a token and he can get a dinosaur. If he gets it wrong, we go through a correction procedure where we like prompt the correct answer and then ask him again, giving him the correct answer. And then usually we'll distract him with something and then ask him again. And we do follow second delays, and so if he doesn't get it within the second delay that we're specifically on for that lesson, then we'll prompt him immediately. During this lesson, they used a lot of UDL principles for the multiple means of representation, so for perception, options for comprehension, and maximizing transfer and generalization. Which is kind of what I was touching on earlier, is that he kind of struggles with this. So it's super important that we make sure he's really getting it the first time, so that when it does come to us generalizing it with him with different objects and people and stuff, he's able to do that. And then also varying the methods for response and navigation. So That's what I was talking about with the second delay. So it just depends on how he responds, and that also determines, like the type of reinforcer and the level of reinforcement. If he gets something wrong, he's, probably not going to get the biggest reinforcer, but if he gets it on a prompted trial, then we might give him like a little bit of a tickle, but if he gets it right all by himself, it's like throw him a party. It's awesome. And that also goes with this checkpoint 5.3 as well, where it's based on differential reinforcement.